people are tempted towards these drugs and which are very, very dangerous and detrimental to their health. So what is it that tempts them?
You come across a person who started the drugs for the first time when he had to celebrate something, let's say birth of his son. There's a person who lost his son in a road accident. The son died, and someone told him कि अगर आप ये drug लोगे तो थोड़ा सा आपका दुख जो है वो कम होगा. Now we are here in front of two different persons who are poles apart as far as the reasoning is concerned. Drugs आप use करते हैं अपने mood को change करने के लिए. Any mood which you are not comfortable with, may it be happiness, you want to enjoy more than that, may it be sadness, you want to be sad more than that, or you want to eliminate sad altogether. दोनों सूरतों में आप ड्रग्स की तरफ जाते हैं.
What exactly happened to your nervous system when you take these drugs?
Actually, most of these drugs, these are creating a numbness in your mind and in your body.
With Zainab, space where you come home to yourself. This is Zainab, and here we explore what it truly means to be well, not only in your body, but also in your mind and soul. Today's guest is a very special guest. He has practiced psychiatry and worked closely with individuals who had drug addictions. Beyond his medical practice, he's also a philanthropist, using his time and resources, helping people and causes that uplift communities. We have Dr. Mansoor. Thank you so much for coming. I know कि आप usually podcast में नहीं आते, so it means a lot to me that you have chosen to come to my podcast.
My pleasure. Thank you.
Okay, so starting with, I know that you have a lot of experience dealing with individuals who are battling drug addictions. So starting from this, that according to you, what is that one void and that unmet need that tempt them towards drugs? Because abhi, especially in Pakistan, I mean, it's happening everywhere in the world, but especially in Pakistan, what I have known and what I've analyzed through my relatives, nieces and nephews who are currently in college and university, it's extremely common. It's common like smoking. Hamesha se hogi, but not as common as it is in present time. So what is it? And जो prime time है आपकी life का, which is between 18 to 30, people are tempted towards these drugs and which are very, very dangerous and detrimental to their health. So what is it that tempts them? Starting from there.
That's a very good question. Or if you would allow me to rephrase this question, so I would say that basically you're asking me what are the most common causes for which they are going for the drugs. So इसका बड़ा एक interesting answer है कि people use drugs because of the reasons. So जितनी भी कहते हैं कि if you make a list of 1,000 reasons for starting the drugs, someone will come across your life with 1,001st reason to have started the drugs. For example, आपको मैं example देता हूँ जिससे आपको ये further clarify होगा. For example, आपको you come across a person who started the drugs for the first time when he had to celebrate something, let's say birth of his son. So his friends came and they said let's enjoy, and वो drugs वगैरह वो एक शुगल के तौर पे इस्तेमाल करते for the very first time. Now we come to the second example. Second example is there's a person who lost his son in a road accident. The son died, and someone told him कि अगर आप ये drug लोगे तो थोड़ा सा आपका दुख जो है वो कम होगा. Now we are here in front of two different persons who are poles apart as far as the reasoning is concerned. One is starting drugs because a son is born to his house, and the other one is starting the drugs because उनके बेटे की death.
But don't you think mostly it's related to pain? कि कौन सी unmet needs हैं जो आपको लगता है कि void है अंदर, that tempts them. कोई void है तो I'm getting attracted towards it, right?
जी. The point is कि ड्रग्स आप यूज करते हैं अपने मूड को चेंज करने के लिए. एनी मूड विच यू आर नॉट कंफर्टेबल विद, मे इट बी हैप्पीनेस, यू वांट टू एंजॉय मोर देन दैट, मे इट बी सैडनेस, यू वांट टू बी सैड मोर देन दैट, और यू वांट टू एलिमिनेट सैड ऑल टुगेदर. दोनों सूरतों में आप ड्रग्स की तरफ जाते हैं. सो लेकिन हैविंग सेड दैट, one of the basic reason is the peer pressure. Peer pressure is one of the basic reasons.
Yes.
Because if we speak from percentage point of view, the vast majority comes, but then you have got other reasons as well, which I just mentioned. So this is
because you want to fit in.
Yeah,
right. वो टाइम ऐसा है कि
peer pressure,
you want to fit in कि ये सब मेरे friends कर रहे हैं, so if I will not do it, I will be judged or I will not be a part of that.
Yeah, and then
crowd.
you come across the drug pushers as well, and then you are bullied as well for not using the drugs. So sometimes you feel macho person by using the drugs. I mean, there are so many reasons again within that peer pressure group.
And what have you noticed in your experience so far? How much family is supportive? I'm sure they must be. I mean, they want to take it out, but supportive in terms of कि हाँ उनको आप psychiatrist के पास ले जाओ. But after that, जो उनको घर पे एक help चाहिए, do you think most people are aware of it or they know how to do that help?
Actually, when we talk about addiction, basically it is categorized amongst the chronic diseases. I mean, it's not an established fact. There are people who differ with this point of view, but I strictly believe that it's a chronic disease and it's a metabolic disease as well. You know, you come across patients in your life who are patients of so many things which we ingest very normally in our lives. For example, in fact, they say everything which a human body takes inside inside itself, you'll find one person who is not fit for one of those chemicals. For example, when we categorize the food which we take, we categorize it into three main categories. It's carbohydrates, proteins, and fats. Exactly. And you'll find patients who are not able to digest carbohydrates.
Exactly.
You will find patients who are not able to digest fats, and then you'll find patients who are not able to digest proteins. For example, the patients who can't digest proteins because it's a comparatively rare disease, so it's called gout. So patients of gout cannot digest protein properly, and then there are so many other complications with that protein indigestion. So coming back, then there are certain molecules which we ingest, like salt. Again, you will find a person who is not able to take salt. We call them hypertensive patients. And then so much so that a little bit of pollution in the air, and you'll find patients who will become severely sick. And we call them
bio-individuality. We all have different kind of...
So similarly, one of the chemicals which we ingest in our body is an addictive chemical, right? So for the sake of discussion, I will use the word alcoholism, for example, because alcoholism is the most studied disease, and alcohol is the most studied drug. So any person who takes alcohol inside the body is now liable to become a patient. It's not 100% of the persons who take sugar in their body.
Even if they take a little bit? A drop of it?
Yes. Because you'll find, now we'll have to study two diseases in a comparative way so that the understanding is a bit easier. Now, for example, you will find a child born with diabetes who has never tasted sugar, but he is born with diabetes. So similarly, you will also find a person who is born with alcoholism. Alcoholism is a disease.
Wow.
Yeah, because some of the parents might be alcoholic, and even if they have quit that disease, you'll come across a person who will be born with alcoholism. So,
but how can you detect that a child has the symptoms of alcoholism, though he's not?
Because whenever he will start it as an addict. Maybe he starts it at the age of 20 years. He never realized that I've got a hidden disease inside me. But that
gets triggered with just one drop or one.
Exactly. So,
and it's true with any other drug as well?
It's true with any other drug.
Okay. Yeah. It can be a food drug like a sugar or any kind of thing. Yeah,
sugar, or for all the mood-altering chemicals or substances of abuse, we call them. So with any other drug, it is very much possible. Not possible, it happens like that.
So coming back to the family, what do you think that in your experience, does the family support, do you often see?
Yeah. Now, when we talk about the chronic diseases, in every chronic disease, they say the patient should be educated for his disease. And the patient education plays a major role in any other chronic disease. For example, diabetes, you must be knowing some of the diabetic patients. They know how to check their blood sugar. They know how to check their urine sugar. They know how to increase or titrate the dose of insulin or whatever medicine they are taking. So that is the responsibility of the patient to take care of the chronic disease. But when it comes to the addiction or any chronic psychiatric medicine, the patient is not able to take full responsibility of himself. And then comes the role of the family. And then the family is not mentally prepared to play that role, because they cannot take responsibility for a person who is into drugs round the clock. So what happens is the patient, and if they do take responsibility, they take it in such a harsh or a strict way that the patient becomes rebellious within his mind, and he tries to find a window where he can have an escape. So the fact is that ultimately patient relapses. And another very important point to understand is that the whole world, if it stands united on one single issue, is the drugs. Because you will come across the drug money, drug trafficking, and in the banks they ask from you.
But still, there is so much, I think, talk about drugs, and there's a campaign against drugs worldwide. Is, I think, the very same reason why the weapon industry is still flourishing, despite everybody's talking about it, or drug industry. We know that, it's a big mafia out there, that's why it will always prevail.
Yeah, it's very interesting. The biggest drug of abuse in the world, recognized biggest drug of abuse in the world is alcohol itself. And then no one can claim we should put a ban on alcohol. But by the way, it would be very interesting to know for your viewers that there was a time in American history when alcohol was banned there.
What time was that?
It was early 20s. They banned the alcohol.
You mean 1920s?
Yes.
Okay.
Yes. They banned. They call it probation period, and during that, because there were so many crimes related to alcohol and related chemicals, that ultimately they decided to put a complete ban on alcohol. I think it was 1917 to 1923 or something like this. So,
out of all the drugs that you have ever experienced, or even based on your own analysis, जिसमें आपका आ जाता है alcohol, it could be sugar, it could be all kind of chemical drugs, heroin, cocaine. I mean, I don't know. There's so many now, ice and all. Which one do you think is the most dangerous? Like, you take even a little bit and it's very hard to tackle.
Yeah, now we are talking about a thing which is called addiction potential. So every drug has got a different addiction potential. For example, alcohol has got an addiction potential of 10%. If there is a population of 100% alcoholics, 10% of the people must be having alcoholism. So that is by definition. But then on one side, 10% is a very small figure. But when you talk about a whole country, a country like, let's say, USA, the population of the country is supposedly 400 millions. Then 10% of the 400 millions comes to 40 million, I believe. 40 million. So 40 million patients of one particular disease is some very big issue for those countries. So the point is and then on the other side, we have got heroin, for example. The addiction potential goes to 97-98%.
97-98%.
Opium.
Even someone with a very clean history.
Yeah.
If I take even this much, and I can be an addict.
No, not on the first usage. But after, let's say, if you consume heroin for 4 or 5 consecutive days, then ultimately you will start rolling towards that side where we call them recognized addicts.
Okay.
So similarly, for hash, it is considered one of the safest drugs, but no, I won't agree with that. So hash, for example, has got an addiction potential of 15%. And the worst part with hash is that you can develop those psychological problems as well. We call it drug-induced psychosis. So
which are like some of them?
Drug-induced psychosis. The typical example I would give you is because hash is derived from a herb, we call it bhang, for example. So
Yes.
once you grind it and dry it and then you make a paste of it or powder out of it, those all chemicals are related to each other. Now, the typical example of hash addicts are those malangs sitting at the mazars of our society. So they cultivate bhang and they are into a different frame of mind altogether, having those psychosis issues. But the people around them, they are so religiously believing in their ये अल्लाह से लगे हुए हैं और ये बस अल्लाह अल्लाह करते
They have this
हैं,
connection,
and
yeah, I
then
know.
whenever they get up, they are into a frame of mind, then they make some sort of dance or whatever, and then they endorse their feeling connection with God, and the people believe in it very easily. So it happens.
So kahin na kahin sari ki sari have some sort of danger involved. But you said heroin is the number one, 98%.
Heroin is number
potential.
one, and now these other chemicals which are in the market, which are heroin or hash or alcohol, these are sort of organic matters. They are derived from the some.
Even heroin is an organic matter.
Yeah, it is derived from opium. Opium is an organic matter. But then now they have come towards those chemicals which are synthetic molecules. Those synthetic molecules are having much higher potential, and the students, that's why they get involved into those, because they are easy to use. They don't have any smell. You don't have to burn something, or you don't have to use a cigarette at times.
In synthetic, which one do you think is the most dangerous ones?
These ranging from LSDs to ice, these are all synthetic chemicals.
Including LSD and all of
yes,
them?
Yes, these are all prepared in the laboratories.
Okay. And what exactly, just for the understanding, what exactly happened to your nervous system when you take these drugs?
Actually, most of these drugs, these are creating a numbness in your mind and in your body. Numbness to an extent that you become anesthetic for that reason. For example, opium, if you take the example of opium, at once...
Like some compartments of brain, not exactly the entire brain, but maybe suppose there is some pain memory or some of the things. They go and they just numb it.
Yeah, they numb it. But you also numb the feelings, you also numb the pain, you also numb the emotions, you numb everything which is relevant for a healthy human mind and body.
Yes, yeah.
So coming back to that point, the opium, for example, it was at one stage in history, it was called God's own medicine. God's own medicine, because at that time this was the best painkiller, anesthetic. It was the best antitussive. It could suppress the cough, any type of cough you can suppress with it. And then it was an aphrodisiac, and then it was a relaxant, and then it was anti-diarrheal. So these were these are probably the five main ailments which we face in our life. Either we are having cough, or we are having diarrhea, or we are having pain, or relaxation issues, or aphrodisiac. Then these issues were being addressed by this one single drug, and that's why it was called God's own medicine. Now, humans have refined this medicine into heroin, for example. Now, we have seen patients to an extent that they decay their entire denture, all the teeth of their mouth are lost, but they don't realize, because caries is such a painful feeling that you have to rush to the doctor. But at the same time, they are utilizing those chemicals, painkiller, which are I would say, best painkiller on earth. Those painkillers they are using as drugs of their choice, and then they don't realize about the pain, and they lose the entire denture of their mouth, but they don't realize the pain they are passing through. And similarly, they can burn themselves. For example, if they are taking some drug with their cigarettes, for example, now when the flame of let's assume they are sleeping in their bed and they have lighted a cigarette, and then that cigarette, then they are at the same time feeling drowsy. If a normal healthy person would light a cigarette and still he would feel drowsy, the flame of the cigarette, when will come close to his fingers, he will realize the pain, and then he will extinguish it. But
usse pehle he would not feel.
But I mean, if you are sleeping, for example,
if you're sleeping and have the cigarette,
and the flame comes near to your fingers, then you will wake up immediately, and then you will extinguish the cigarette. But when it comes to a person who is using the very same painkiller like heroin or opium, the flame comes closer to you. You don't feel the pain. And ultimately, that cigarette falls on your bed. You can burn burn the whole house or things like that. I mean, in extreme cases, we have seen patients roll over their newly born kids and asphyxiate them, and the kids died, but they never realized that they are lying over.
They never realized
they are lying over their own kids. Yeah.
It's. I mean, I'm glad that you raised this. This topic about कि opium was considered the medicine and the very God's own medicine. Because abhi what I've seen, and it's also my own question as well, because I'm very confused. Ke there are some plants which can be considered as drugs, but at the same time they have healing powers, right? Like marijuana, for example, in 80s or 90s, that was, even now I think many of the countries are actually legalizing it, because again it's all about the doses, what doses and for what purpose you are doing it, right? But so same goes for all of these plant-based drugs, which are there in nature, not the synthetic one. What do you think? They have healing powers actually, but it should be prescribed by, like, we should know like how much dose to give and all of those things. Like,
it's like I would call it like playing with fire. But when you have got bigger reasons to allow the marketing of such drugs, like recently we saw it in Canada. They legalized marijuana there, and marijuana is like hash or what you call it, bhang. It's the same family. So, as I discussed earlier, that you can develop a very strong possibility of developing psychosis. But if we go into the detail or background of the reasons why Canadians nationalized this drug or why it isn't being nationalized elsewhere, you will come to some very strange arguments. Like, for example, cocaine was so much in the market, we wanted to reduce the smuggling of cocaine within our market, and this was one of the easy solutions. So that's not a humanly acceptable answer. Because you are introducing them to a lesser evil rather than eliminating the evil, which is the prime responsibility of any government in the world. So this is a very strange argument.
But it has also been, there's a lot of research done on marijuana. I forgot the name, but he was a very famous scientist again in 1980s, 90s, who said that if I will tell you that how many illnesses you can cure from this. And one theory is also that the reason why they have banned it, because they know that it can heal so many illnesses. I don't to push their own synthetic drugs. They don't want to. So maybe because if the plant is there, it is there in nature. So yes, I know that there are so many plants which can be toxic, and which you should know how to use and what to use, right?
Again we come to that point. If we take a drug, if a person has got a hidden addiction potential inside his body.
That you don't know whether you have a hidden potential or not. Okay.
So we are exposing everyone to a risk of getting an addict to that drug. So, if a government stops, if a government thinks that they can stop cocaine smuggling by introducing marijuana or hash for that matter, then that's not a decision based on health policies. It's a decision based on either interior government's policy. It's a decision based on because a lot of money is being drained out with those smuggling activities. So this is a decision based on monetary interests. But these decisions are not based on health reasons, number one. Number two is that there is a term in medical field, we call it palliative treatment. Palliative treatment is that when a person is destined to die in the next few weeks or months, then instead of going after the normal logical arguments of not putting him on drugs which are having high addiction potential or something like that, you should facilitate his death. in those cases, I would agree that yes, if there are some drugs which can reduce his pain, for example, we have got injections like pethidine and morphine, like those are again the derivatives of opium. So they have also got very high addiction potential. By the way, this heroin which we are using in the streets, its chemical name is acetyl diamorphine. So acetyl diamorphine was again a drug provided to the soldiers in Second World War as a part of their first aid kit, that if they get hurt because of some bullet
so
or
that
bomb,
pain can be numbed.
so they can inject themselves with acetyl diamorphine.
And it is that powerful that it can have an immediate effect?
Yes. It's the most powerful painkiller because, as I told you, it's a derivative of opium, and opium was considered God's own medicine. And the top quality of this drug was the best painkiller. In fact, in those old days, if they had to perform some sort of amputations or some other surgical procedure, they were giving opium to the patients before doing those procedures, towards getting addicted to it as well. So if a person is passing through some terminal phase of his life, or a doctor think that now it's time to start palliative treatment because to facilitate his death and to keep him at least pain free, I mean, there is no fun in it if a person is shouting with the top of his lungs and because of the pain, and we say, okay, we cannot give you a painkiller because it has got an addiction potential. No, I don't agree with that. Those patients should be facilitated at least to kill their pain. So those type of patients, if they feel that some type of these drugs are helpful for them, yes, that should be legalized.
Okay, that
but
also
not for
leads
an open
to,
society.
That also leads to very interesting another question here. You said the common factor is that, again, you're saying that immediately pain relief is happening through this drug or opium or whatever, means that we have established that most of the people who get addicted to it or who started it at the first place, they are going through some sort of pain. Not essentially, like you said, that there are some people who are doing it for fun, right? That's different. But I think even those who are doing it for the superficial fun, there is something that, like you're feeling deep void or something. Now, what I feel is, if they do not have this drug option, I mean, they have a drug option always, but I'm talking in terms of the overall community, कि मेरे पास ये drug की option है. But what is an alternative to it? कि, okay, I will not go for drug to reduce my pain, or what is needed. Like in olden times, I know there was a sense of community living, or maybe your friend circle who can reduce your pain, or you can talk to someone. Do you think it is deriving from because we don't have enough people to talk to about our pain, or that community living, that non-judgmental society, or even parents or family where we come from? You feel so alone that tempts you or push you towards, okay, it's better I just take an injection and I feel good.
Though interestingly, first of all, we should define addiction. What is addiction, for example, right? And for that matter, addiction, one of the definitions of addiction is that when a person is having spiritual problem, physical problem, or psychological problem, and social problems, then we say that he has got an addiction problem as well. Basically, it's loss of control on the drugs.
Yes.
So the first thing in this definition is about the spiritual problems. And if we define spirituality, because I'm coming back to your point, it comes closer to spirituality. So coming back to the spirituality, how do we define spirituality? For that matter, spirituality is defined with your relationship with yourself, your relationship with the people around you, and then with people and the places around you, and then your relationship with the Creator. So this is the spirituality. Now, if, for example, if you come across a typical addict in the street, so the first thing you will notice is that he will not be in a very neat and clean condition. He has taken bath or combed his hair or brushed his teeth probably weeks before or months before, and things like that. That's a typical. So that is the first step when you lose spirituality. And then you come across the surroundings and the people you live with. You don't have any love left for the people around you. You don't have left any love for the places around you. I mean, I consider those persons spiritually deficient, even those who are throwing litter in the streets. So there is some level of deficiency in them. So these all things are like, and then of course you forget about your Creator. So the first thing the patient should go through is a very strong psychotherapy, during the treatment, and he should be told how to be a spiritual person. And the basic of spiritual person the very basic thing from where a person can start his spiritual journey is being thankful for what they have. So they are always comparing themselves with other. They're always comparing themselves with those things or places or persons which are not accessible to
So
them.
you what I'm understanding is you're saying the reason why I'm opting for drugs because I am lacking that basic sense of spirituality, of being grateful, or is it can be any other thing that I'm.
Yeah, it's one of the things. It's I mean.
But I also feel there's a support system that we are lacking
the
as well.
support system which a family can provide, you cannot contest that, but it's not the only support system which is needed because if you start addressing a patient and telling him what to do and what not to do, he's not an ignorant person. Believe me, one of the established facts is that addicts are persons from a society who are having higher IQ as compared to their peers. I mean, if it's a servant, he will be more intelligent than rest of your servants. And if he's a doctor, he would be more intelligent than rest of his. They are already having a higher IQ.
You think maybe they're more sensitive beings? Or more high EQ or more high IQ, and that's why, because they are way more sensitive, that's why they have a tendency to feel more pain, and hence could be
more sensitive and probably more daring as well. Because if a heroin is offered to a normal person, he probably will simply step back. No, I'm not going to touch it. But those persons who will touch it and try it, let's have a trial of this thing.
I can do that. Yes. Yeah.
So those persons are basically more daring person, and they are overconfident because they are intelligent. Their intelligence has helped them in their lives, so they know that they are intelligent at least at an unconscious level. So they know that they are intelligent, and then they say, okay, we'll see. We have come across so many problems, and we have sorted out those problems. So this is not a big problem. It's just a pinch of powder and thing like that. So these things come to their mind, yes.
Also, this is a very common trend that's going on currently, that all the kind of drugs, different kind of drugs, have been used in micro doses in the name of spirituality. Like, I know I have met people and they claim, and they're very well-read people, it's not like someone who is like a druggie just lying around, very educated people, that having a particular drug, it could be LSD, it could be anyone, I don't know, that a microdose, not like to a very extreme level, that having that, they do have certain experiences that really led them into self-reflection of who they are, what traumas they are carrying, about their ancestors, about their parents. They can see a better picture, they can have better clarity, they can have a better connection with the Creator. Do you feel that some of the drugs has an ability to activate those, I don't know, parts of your brain? I know it's still a risky phase, like you said. I don't know if I have an addiction potential or not.
I know this fact, for that matter, that some of my very close friends who are very highly placed in the society, and they are highly educated, I mean, they time and again they come across such maybe weekend events,
such revelations or whatever,
weekend events or something like that. Now, having said that, they are still with, let's talk about hash, because only the chemicals derived from hash are claimed about these things. So, talking about hash, if anyone consumes those chemicals, he is very lucky in the sense, because he's in 85% of the people who are not getting addicted to this chemical. He's still carrying that chance. He's lucky in the sense that he has not crossed that thin red line which makes you an addict or a patient, for that matter. So yes, they are lucky, and these chemicals, they are known to have the ability to bend your thoughts, to enhance your thoughts at times. And I met, for example, some players, cricket players, for example, I met few of my during my career. So they said that I asked them that how can you play cricket while a person is throwing a ball at you with more than 100 km per hour speed. So they say that when we are playing, that ball size increases for us. That's why we
wow.
So, I mean, everyone has got a different experience. So, the end of the point.
So they can see ball more clearly, and they can they can excel in it. Okay.
So, but again, you have to think of those risks which you are facing at the same time. It's like sitting on a volcano. Like a volcano can erupt anytime, but as long as it's not erupting, you should not celebrate it. You should try to get away from.
But healing powers hai. Again, in microdosing, if you are doing under guidance or anything, you think they have a potential to do that?
I think unless these chemicals are not patented by some drug regulatory authorities, only till that time, I would still say no to these drugs.
You mean to say in a raw form or?
No, patented and brought into the market in the form of allopathic medicines, because at the end of the day, allopathic medicines are also coming from the plants and all type of chemicals which, if you use them in a raw or crude form, for example, those medicines which are used in a raw or a crude form, they are all carrying those risks. But when you refine them and those risk-carrying part of the molecules are removed, and only those molecules which you want, who can directly affect or address the problem you are using it for, can be created. Such molecules should be patented, and then those molecules should be prescribed via authorized
But you're
person.
saying that it's still dangerous to have it in a raw form. I cannot take the leaf and crush it. Because I don't know the dose. I don't know, again, only a chemist would know that, right?
Yeah, not even the chemist. I mean, being a doctor and being a student of pharmacology, and I would never agree to anything which has not been patented.
Okay.
It has to be patented. Once it has been patented, then
what do they do in patented? Like you were saying it. What exactly they do in that?
No, once a drug is patented, then there is a process for patenting a drug. For example, you try this drug on 1,000 persons, and then you create a data out for that particular drug. This drug created this problem in this percentage of people. This drug created this problem in this percentage of people. And if those are very negligible percentages, then
you mean to say, like, you have to do some case studies and all, and only then you
the proper
a proper method. What is there?
That's the back end story of any patenting drugs.
Okay, so in your entire career, was there any transformative story that you have witnessed, and you still it's there in your brain, like that was the most transformative?
There are a lot of stories. There are a lot of stories, but I would simply mention two stories here. I've got a friend. I won't name them, although they don't mind it, because, but still I won't name them for the sake of anonymity. He was a drug addict. He was a sub-engineer. He was drug addict for about 20 years. He left addiction. Then he not only left addiction, then he started a self-help group. By the way, self-help group is one of the basic treatment to quit any addiction. So, and those self-help group are there in the field for the last maybe 100 years. The first self-help group was started for alcoholics. It's called Alcoholics Anonymous. But then those people who were not taking...
But ये हर जगह है. Like it's also in Pakistan. It's everywhere in the world.
If you want to find them, you can find them. So those self-help groups, one point we just missed earlier in our discussion was that how the family can play a role. The patients, they do not recognize family as a therapist, because उनके दिल में जो basic बात होती है, they say that the pain through which I am passing
is by the family.
No, the pain through which I am passing, you cannot realize it. So how can you address my problem if you don't realize what problem I am facing? Okay. So that
I feel also, because family जितना मर्जी supportive हो, there is some sort of judgmental attitude is there. How can she do it? How can my son do it? How can my daughter do it? How can my sister do it? So एक वो चीज़ है, even if they are trying to be supportive.
No, that's very natural. Because the parents are not trained therapists. They don't know what to speak and what not to speak. They speak out of their pure emotions. So when they speak out of their emotions, they speak so many things which might not be recommended in a therapy. But then the patient should realize that they are not therapists, and that's what he realizes when he says that you people cannot understand my pain. So his pain is understood in that self-help group.
Okay.
Though there are people who are participating in the self-help groups, for example, when we talk about heroin or heroin-related chemicals, we call it Narcotics Anonymous. So those patients would go, because these initially they thought that maybe all the self-help group has got the same reasoning behind. So an addict to heroin can join a self-help group of alcoholics as well. But then they said that no, they want to make a separate group. So narcotic patients, they made a separate group called Narcotic Anonymous. Those patients who are addicted to narcotics, they should go to that self-help group, and there they will find patients who recovering. We call it recovering patient. We say that recovery is never completed in your life till your death. You are all the time recovering till your death. Even you are not using drug, that is good, but you are still recovering, because the moment you touch it, you will relapse again. So you have never recovered to touch it in a healthy way. So that's why we call them recovering patients. So when a person goes to a self-help group, he will find so many recovering patients there who are much higher in sobriety.
And that would be an inspiring story for them.
That is an inspiring story for them. And when he shares his problem with them, because at the end of the day, we say, for example, you don't come across, if a doctor sees, let's say, 1,000 patients in a month or in a year, basically there are only 2 or 3 problems which he is addressing, talking from the psychiatric point of view.
Okay.
So when a patient is mentioning his problem to his peers in the self-help group, that patient is not telling a new story to them.
It's familiar. It's familiar. Story.
They have already passed through those phases, right?
Yes.
Through those stories. So they would share their experiences with that patient.
So what was that one thing that you think your friend, it really worked for him?
Yeah,
self-help.
Yeah, he quit the drugs. He went into a business. He not only joined a self-help group, but he established a self-help group in Lahore.
But what was one thing that led him to, think about कि मुझे अब addiction नहीं, मुझे इसमें से निकलना है. That one thought, क्योंकि अक्सर लोग तो उसी में से निकल नहीं पाते.
In addiction, we use a term, we call it hit bottom. Hit bottom, we say that then when a person realizes that
इससे नीचे मैं नहीं जा सकता.
He has hit the bottom. Then he has got only one choice. But the art of treatment is to get them out of this problem before they hit the bottom. Because वो कहते हैं ना कि सारा कुछ डुबो के ठीक हुए तो क्या हुआ. कई दफ़ा पेशेंट्स के जहन में ये ख्याल आता है. Although as a therapist or doctors we always say कि जी it's never too late. There is always a
but they might think okay, now my family has been ruined, सब कुछ खत्म हो गया तो अब मैंने क्या करना है. That might come.
So coming back to that patient, he lost all of his family members one after the other because of natural reasons. So when he was left alone, then he decided that I have to quit. Then he got married. Then he got established himself into a business, and then he established a very nice business. Similarly, I know one other person who found healing in therapy. Now he visits different prisons for that matter, and in the prisons he addresses them for the last. He's
giving therapy. Okay.
Yeah, because when there is a certain philosophy for these patients. We call them 12-step therapy or 12-step program. Those programs. This program was introduced way back in 1905 by an alcoholic himself. So those alcoholics started, and then those 12 steps were translated into other with reference to other chemicals. So they are more or less the same 12 steps. So they go through those 12 steps. It guides them at each and every step how to pass through this phase, how to cross this phase, how to cross this phase. And then that whole group supports them, and then they exchange number with each other. Then they make someone their spiritual healer or leader, and then those people are available to them around the clock. Whenever they want to have a word with him or seek guidance from him, they just call him, and then they... So it's a complete system in which they are working. But where come the doctors play a role in it? The initial treatment and to let them be comfortable enough to go and join a group. That is part of the doctors. And once they are into the self-help groups, then that self-help group has got its own healing potential.
Okay. So other than these things, like, going to psychiatrist or maybe psychologist for counseling, whatever, like all this help, do you think that other than this, the supplementary treatments like breath work and exercise and yoga and some family love support, how much this plays a role, or healthy diet in I don't know, this detoxing the nervous system? Do you think it also equally important?
It's very important, and the healing process starts from yourself.
First, I think you need to acknowledge that.
Yeah, of course.
I have a problem.
I have a problem.
Yes.
You have to come out of that denial phase. But that is the responsibility of the doctor or the treatment facility through which you are having your treatment. And once you get out of the hospital, you are at least in a clear phase of mind that you can differentiate between a healthy person and a non-healthy person, and appreciate that you are not a healthy person when you are using the drugs. So that after crossing that phase, the individual effort starts from yourself. Expecting everything from the family is not justifiable. So,
but their role is important to some extent.
Yeah, their role is important.
Of course, they cannot do everything.
Yeah,
they don't know. Yeah,
their role is important, but then their role should not be a loving role. It should not be bowing to all of their demands, because at the end of the day, these patients are very smart people. They are very.
They know how to manipulate.
They know how to manipulate, and then somewhere during this process, they lose their track and they go into manipulation. And then during that manipulation, they जैसे कहते हैं कि अपना उल्लू सीधा कर लेते हैं, and family is left with the feeling of disgust and passing through a phase of unbelievability. What has happened? हमने तो सब कुछ किया था. Then there comes a feeling of hurt in the family. What we have not done for this particular person. So that hurt at time become painful also for them, and then their pain is reflected in their behavior also.
But if the patient acknowledges, first step has been achieved, that okay, I want to fix myself, then you think all these supplementary things, it plays a crucial role, like exercising and diet and stretching and breathing, all of those things.
Yes, it's very important. It's very important, as I was discussing earlier, as part of the definition, that the part of the recovery also starts, it has to be a spiritual recovery as well. And the part of the recovery is, because if you're not at peace in your heart, you cannot be at peace with the rest of the world.
Yes.
So you have to start the journey from yourself, because at the end of the day, there is not a single disease in the world whose pain can be taken by someone else. The patient has to take the pain. I mean, you may have the endless amount of wealth in your hand, but if you are breaking your finger, you have to face the pain and the consequences. You cannot ask someone to purchase it for you, or out of money or out of compassion. No one is going to trade it with you. It's humanly not possible. So it has to start from the patient himself. I don't deny the role of the family, but major role has to be played by the patient, right? So he should...
And I think what you're saying is that patient has to come to that point of acknowledgement by himself. Nobody can convince him.
Yeah,
right?
It is his journey. He has to come on.
He has to go through that.
Everyone around him are willing to play a very positive role, and they do play a positive role. But because sometimes our families are not fully trained, there is a concept we call it tough love. Tough love is a process. For example, there's a person in the family who's an addict, and he's the youngest son, and he's the most dear to everyone, and he's married as well, and now he's not earning anything, and the entire family pulls money in, and they are feeding his family. Now the point is, what is the reason for him to get recovered? His family is being fed, he is having it, so why should he be faced? So he should help, he should be helped.
It's okay to have him feel the guilt.
Yeah, no, not only feel, he should be helped to face the consequences. This is the true love. But we mistakenly consider that feeding his family is the true love. That's not the true love.
Yeah.
True love, that's not going to help him. No, that brings us to the point that why, for example, in our cultures where the family bond is very strong and still we are living in combined family systems and everyone is very closely knitted with each other. In our countries, the recovery rate from such addictions is lower as compared to those societies where if the patient is not coming out of his addiction problem, sooner or later, he has to face the consequences. And
by going to the mental hospital, or
no, once he gets a treatment and he decides to relapse, then he has to face the consequences, and very soon he comes on the footpath or homelessness. But we would never let it happen to our patient. So that brings us to the point that we are in fact not helping the patient. We call it enabling. We are enabling him to continue the drugs.
Yes. Also, I mean, you are also a parent of 2 daughters. And I think one of them is still a teenager, if I'm not wrong. Yeah. So from a parent's perspective, like you have seen both, you have seen as a doctor and you've also seen as a parent, how to just, because we are living in this era that everything is very, very tough for parents. Like exposure is too much. Like maybe we can say when, I was growing up and I don't know, I haven't come across in a situation where drugs have been offered or it was being there, right? But nowadays we don't know. In colleges, universities, like you also want to give wings to your children. You can't just be very protective towards them. So as a parent, what do you think that, what is it? Everything is there. What to do, what steps to be taken to really, prepare them that if this kind of situation happens, we are not supposed to go towards this path of, fitting, is a peer pressure can be there, like all their friends are doing drugs or it's a very cool thing to do. How to prepare them as a parent?
Yeah, that's a very interesting question. And that brings us to the point that we are passing through a very transitional phase in the human history.
Yes.
So, for example, our parents and before them, their parents, they were living in the same world. But our parents and our kids, for example, are not living in the same world.
Yes.
So, we need to have some very special trainings in that context. So, the first thing is the parents should not go for a child unless they are not mentally prepared for it. You have to be mentally prepared to own a child because, as they say that everything comes in your life with a package. So if you want to have a child, the child will come with a package. Packages, you will have to give time to him. You have to
make little sacrifices.
You have to make sacrifices. Yes. And those sacrifices are very important. So sometimes I've come across the patients. The point is that when you come across your first child, at times both the parents are struggling in their own capacity, in their own professions. So the children are not getting sufficient time. And there's a very common phrase and a concept supported by evidences, medical evidences, that as much time you will give to a child, the child will return the time to you at a later part in
whatever you
life.
Give.
Yeah.
If you give a lot of money to children, maybe that will come, if not time.
Yeah.
But I think it's like it will come back to you. Yes.
So especially talking about the time, because time is the most asked thing for.
Yes.
Number one. Number two is there should not be contradictions in our words and in our actions in front of the children. For example, अगर मैं अपने बच्चों को कहूँगा उठो बेटा नमाज पढ़ो and I'm myself not offering my prayers, so that's a huge contradiction which I am putting into their mind.
That's what I say कि बच्चे सुन के नहीं सीखते, वो देख के सीखते हैं. The visual power is very, very strong for children.
We have to be very honest. We have to be very clear in front of our kids because they are our reflection. हम जो भी करेंगे वो हमारा ही reflection होगा. और एट द एंड ऑफ द डे अगर बच्चा किसी किस्म का भी बन गया तो वो कहीं ना कहीं हमने कोई ना कोई कमी और कोताही ज़रूर की है.
Exactly.
So उसके बाद there is another very important thing, childhood rivalries. When you get a second child, for example, your attention goes towards the second child and the first child starts getting feeling of neglect. So that can also be very harmful. You need to balance between the two kids now, and you need to console and let the first kid realize that, look, it's he is also here or she is also here now, and we need to divide the time between you and her. So these, and on top of it, I would still suggest that it's my personal opinion that any couple who is getting married, they must see a psychologist or a therapist regarding the child brought up upbringing, because if we are willing to go for any length to upgrade our potentials in our professional field, this is a much more important field than any profession.
Any profession, for sure.
So we must visit a therapist before even the child is born and ask them that how to deal with different part of his or her life. And one very important piece of advice that I would like to share with your viewers is that there are a lot of self-help books available in the good bookshops. Go to a good bookshop and study, pick up a book on that relevant subject and study it. Those books are written by the best of the professionals in the market and out of their sheer experiences. And those books at times really help. This I'm saying because at times people are not willing to visit a therapist because it's they consider it कि जी लोग कहेंगे कि पागलों का डॉक्टर के पास चले। So if you are, you still need help. If you are not willing to see a doctor or a therapist, go to a self-help book, study a book, but please take help.
It's very important. In order to conclude the entire conversation, it was beautiful. I want to ask you, what are the 3 spiritual hacks? It could be related to your physical health, mental health, spiritual health, that you think that these 3 are crucial for according to your own personal opinion. I ask it to everyone, that you think you want to suggest to people that if you do these 3 things, you're good. Your life is going to be good.
I think the first thing is that you should accept yourself as you are. You should.
This is the mind-blowing one. Very good.
You should accept yourself the way you are. Never try to pose like someone else. Never try to be someone else. Be yourself. This is the first thing. And once you come across, once you cover this phase of your life, you become so comfortable with your life. You become so relaxed and serene from inside that the rest of the phases become very easy for you.
Yes.
And second,
but this is a self-created stress we have taken on ourselves. We are constantly trying to be something, trying to be someone.
And then the second thing is be grateful. Because when you become grateful, I will be grateful for anything which I have. So I will not be considering those things which I don't have. So being grateful is very helpful, because once you become grateful to anything, you become which you have in your possession. It might be your family, it might be the possessions, it might be the personality, your knowledge, your environment, your temperature, anything. There are millions of things for which you need to be grateful, but how many times are we grateful to those things?
And I feel most of the people say we are grateful.
But they don't mean it.
Actually feeling it and meaning it, and actually sit down with yourself every single day and saying no. Because we are, end of the day, we are human beings. Let's say that, I am going through a certain challenging phase of my life, or at that moment maybe I'm not feeling grateful. But you're right. You have to make yourself sit and say it, and maybe think about things that is working in my favor.
And the third I would say is love yourself. Because loving yourself will make you into such a refined person that the people around you, which I mean by immediate family members and your friends and your circle, they will cherish that, wow, we are his.
Because I think the more you are in love with yourself, the more you will do investment on yourself. You want to evolve. You want to be a better version of yourself.
And and your better version will be a matter of pride for the people you. Because if you just say love yourself and don't explain it, people take it like being selfish.
Most of the people have this confusion that, I'm not selfish. Though it's nothing to do with that.
The more you evolve, the more better person you are presenting to your partner, to your kids, to your father, to your mother. You are a better person for them.
Exactly.
Be a better person for them. And that is only possible by working on yourself.
Totally, because loving yourself actually means that you are prioritizing yourself in terms of health, in terms of your belief, in terms of whatever you are. I'm giving priority to myself.
Yeah.
So it's very important, yeah. But anyways, thank you so much for coming. It really means a lot. It was
my pleasure.
Beautiful conversation we had, which we never had it like abhi aise one-to-one but we always sit with families. Yeah. But thank you so much. Thank you.
My pleasure. Thank you.
It really means a lot.